Hello, everybody. Thank you for joining us. We're just going to wait another minute or two if that's okay for other people to log in. So hold tight and we'll be with you shortly. Thank you. Okay, we're going to kick this off. Want to introduce myself. My name is John Croce. I am the district manager here in New Jersey, and want to thank you all for joining us tonight on this webinar from Dr. Dan Savarino from Apex Regenerative Medicine. And tonight he's going to speak to you all about hormone optimization utilizing the BioT method. So without further ado, I'm going to introduce Dr. Dan Savarino. Take it over, Dr. Savarino.
All right, thanks so much, John. Thanks everybody for coming out on Tuesday night. Hope everybody's doing well, and I hope we can teach you quite a bit about hormone optimization. So let's get started. Hormone havoc. So this is something that a lot of people experience. We're going to teach you some things like what are hormones and why are they important, and what is hormonal imbalance. Some of the things we'll be going through is what we need to know about hormones, who can you and should you believe about hormones, because you hear a lot of different things about hormones and the different ways that hormones are given, and what can you potentially do to help with this hormone havoc and get you feeling good. So first, let's start with the basics. What are hormones? Hormones are chemical messengers made by the endocrine glands that act to control certain actions of cells and organs. They work in a lock and key fashion. And one of the questions we hear a lot of is, do we age because we lose our hormones, or do we lose our hormones because we age? So, well, certainly hormones are not the fountain of youth. They're not going to help you live forever. Optimizing your hormones will help you age much more gracefully and hopefully help you live a lot longer. So how do you feel on a day-to-day basis? Do you feel like this guy who's mad at the world, clenching his fists? Or do you feel like these guys here are happy and loving life? Do you feel anxious and depressed, or just happy to be and do what you're doing? Does any of these things sound familiar to you? Extreme fatigue. So you hear all the time about people hitting that wall at 3 or 4 o'clock. While they're at work. Mood swings, anxiety, tension and irritability, lack of sleep, people waking up multiple times at night at that 3 or 4 a.m. wake up call, memory loss, depression, lack of focus, brain fog, hot flashes, night sweats, weight gain, joint pain, something I see a lot of in my practice, bladder symptoms, migraine and severe headaches, decreased sex drive and or performance. If you're experiencing any of these things, you are certainly not alone. Most people do in their middle ages and later on in life. And we're going to talk about ways to help a lot of these symptoms. So the BioT method. What hormones does the BioT method balance? So we balance testosterone, estrogen, thyroid. We also balance progesterone. And we also balance other things such as vitamin D. The BioT method also incorporates medical grade nutraceuticals, which are supplements to help improve the results and help those hormones do their job even better. Andropause. So what is andropause? It's the male version of menopause or menopause. 20% of males over the age of 50 have low testosterone. You will see it's much more common in men that have diabetes, high blood pressure, sleep apnea, and lots of other chronic diseases. Low testosterone is linked to early heart disease, which is an important reason other than just feeling good on why we have to balance your hormones. It's very underdiagnosed because most people don't even realize that they have it. And also what we'll talk about later on is people might be in the normal range for a lab value, but that does not mean that they're normal or optimized. You know, on TV, you see a lot of these commercials for things like blood pressure medicine and diabetes medicine and depression medicine. With hormones, getting your hormones optimized, a lot of times we can get you off of those medicines or significantly reduce the amount of medicines that you need. So first, we're going to talk about testosterone. So some facts about testosterone. It provides major symptom relief and protects the bones, brain, breast, heart, and most of all, relationships. It's present in both men and women. There are large amounts in men and small amounts in women. So although we say there are small amounts in women, and it's much less than there are in men, what most people don't realize is testosterone is actually the major sex hormone for women. When women, when you were younger, you were making 3 to 5 times the amount of testosterone than even estrogen or progesterone. So it's a hugely important hormone in women as well. Men aged 30 to 70 will lose 1 to 3% of their testosterone per year. And women, this slide, it's a little bit off, but from the years of 20 to 40 will lose up to 50% of their testosterone. And then if women also have things like a hysterectomy, you lose another 50% on top of that. So you can really drop out your testosterone really quickly in women. So these are some thresholds for different disease processes. So what the numbers there are is the testosterone levels in men, and those disease processes are where what is at that benefit. So for instance, Alzheimer's disease prevention really doesn't happen until your testosterone is above 900. And that's why our optimal level is usually somewhere between 9 to 1100. But you know, you could even see at a level of below 600, your risk for mortality, death across the board is higher than if your testosterone is above 600. You know, even things like type 2 diabetes and libido loss and depression. So, you know, you can see you really want that testosterone at a really optimal level to help prevent all of these things. So the positive effects of natural testosterone for men and women. So this is not your roid testosterone. This is natural testosterone, and we'll get more into that later. But with natural testosterone, you're going to have increased energy, vitality, and zest for life. You're going to have an improved feeling of overall well-being. It's going to help relieve depression and anxiety. You're going to have more clarity with your thinking. You're going to have improved memory and focus. It's going to help with your libido. It's going to help your sexual and just your overall performance. Testosterone is actually very breast and prostate protective. So some people may have heard that testosterone causes prostate cancer, and that's completely untrue. In fact, it protects the prostate. It protects the brain, the heart, your bones. It's going to actually help build bone and increase bone strength, as well as muscle strength. So it's going to make you stronger, along with reducing body fat. So you're going to put on more muscle and get rid of some fat, and it's going to lower your cholesterol. Menopause. So some facts about menopause. So 3,500 women enter menopause every single day. Now, even though menopause for most women starts at about 50 to 51 years of age, symptoms of premenopause can start 15 years before that. So in your early to mid 30s, people start experiencing these symptoms. And most women are affected in much more ways than they even realize. They just don't feel right, but they don't realize that it's because they're going through hormonal changes. And not only that, but most women don't ever completely get over or get through menopause where they're completely asymptomatic. So we in our clinic even have women in their 70s and 80s that are still having things like hot flashes and night sweats and lots of other issues related to menopause. So another big thing with menopause is after you go through menopause, your risk for heart disease more than doubles. So before menopause, the risk for women is 1 in 7. And then for postmenopausal women, that number rises to 1 in 3. And that's mostly due to the fact that you lose your estrogen, and about 10 years after menopause, your risk for heart disease is the same as men. So let's talk about estrogen. So some facts about estrogen. It's present in both men and women. This hormone is more abundant in women and very small amounts in men. However, that small amount in men is very important, and we'll talk about some of the benefits of estrogen later. Estrogen has over 400 functions in the body. So it's not only a sex hormone, but it works on the bones and the brain and a whole bunch of different functions. It controls hot flashes. It helps maintain bone density. It helps maintain memory. It maintains the collagen in your skin, so it gives you that youthful appearance. It helps with the elasticity of the skin. And it increases serotonin and dopamine, which are those happy hormones in the brain. So we talked about some of these, but then it also helps prevent neurodegenerative conditions like Alzheimer's disease. It helps lower your cholesterol, but increase your good cholesterol. And it protects your bone, breast, brain, and heart. So hormone therapy. There's a couple different ways you can do hormone therapy, but there's 2 different types of hormones. You have your synthetic hormones, which you can get in pills, patches, and shots. And what synthetic means is that it's not exactly the same molecule that your body normally makes. And then you have bioidentical, which is identical to what your body makes. So that you can have by pills, patches, creams or gels, and pellets. And we'll talk about later, but in the BioT method, we believe that pellets are the best way to give hormones. Conventional hormone replacement methods. So there was a study back in 2002 called the Women's Health Initiative. It was stopped because they said that the study showed a 41% increase in stroke, increased risk of heart attack, breast cancer, blood clots, and Alzheimer's disease. However, this was a highly flawed study. In fact, the people that did this study went back and reviewed the data, and a year and a half later basically redacted almost the entire thing. The other thing with this study was that they weren't using very good hormones. They were using an oral estrogen, and we'll talk about oral is not the best way to give estrogen, but it wasn't bioidentical. In fact, what it was pregnant horse urine that they were giving to these women. So obviously, that's not very healthy for you. The other thing is they were using synthetic progesterone that we do know causes increased breast cancer. Now, the bioidentical progesterones do not do that. So there was a lot of flaws with this study. Because of this study, many women stopped using hormone replacement therapy and many doctors stopped prescribing it. And it's been shown that it probably has been the result of tens of thousands of women dying young because they did not have those hormones optimized. So one way you can give hormones is with patches. The patches, there's a lot of issues. Now the estradiol levels, which are the estrogen levels, are better than with the pills, but they're not as good as the pellets. There's adhesive problems, so people have trouble getting the patches to stick, they fall off. Plus some people have allergies or irritation with the patches. The patches need to be changed consistently throughout the week. There is some weight gain, but less fluid retention than on synthetic or horse estrogens. And really, most importantly, it's 45% of people do not absorb the hormone through their skin, so they're not even getting what they think they're getting. Similarly, with the creams and gels, there's a lot of issues. So first of all, did you put enough on? Did you put too much on? You know, who knows? You have to rub it in at least once a day, but usually twice a day, and that's just cumbersome. They have a very short half-life, so they don't last very long. Again, there are a lot of absorption issues. 45 to 50% of people do not absorb the gels. Another big thing is you can transfer it to people. So you can transfer it to your children, your pets. Women that are on estrogen creams can give it to their husbands by rubbing up against them, and men can give the testosterone to their wives. So, you know, there's just a lot of issues with that. And most importantly, these creams and gels use something called estriol, which is a much less potent estrogen than the estradiol, which we use for our hormone therapy. And it does not protect the bones, the heart, and the brain. And that's been proven in multiple studies. Now we have the injectable testosterones. So there's uneven absorption with that. They are synthetic as well. the way they work is they're time released. So basically, the testosterone is in a cottonseed oil that slowly releases the testosterone into your system, but it doesn't do it evenly. And the other thing is some people really have reactions to that cottonseed oil, so that can be an issue as well. There are significant adverse effects. There has been a couple of cases of liver toxicity. It does increase heart disease as well as blood clot risk. And it's going to send your cholesterol in all the wrong ways. So it's going to elevate your LDL, which is your bad cholesterol, and your VLDL, and it's going to decrease your HDL, which is your good cholesterol, which we want high. It also always wears off before the next shot. So you're really on the roller coaster with this. So basically, when you take that injection, you go what we call super physiologic, which means that you're higher than you should be. And then when you're ready to take that next injection, you're actually bottomed out again, and you don't feel well, and it makes you pretty cranky. So bioidentical hormone pellets. These pellets are natural plant-derived compounds. Where we get the pellets are from soy or yam. That being said, it is pure estrogen and pure testosterone. So even if you have a soy or yam allergy, you will not be affected by these pellets. It's the same molecular structure as human hormones, so it's the same stuff that your adrenal glands, your ovaries, your testicles make. It lasts longer than other treatments. So again, instead of being on that roller coaster, you're getting 4 to 6 months of steady state hormone. It's also the most widely studied form of bioidentical hormone replacement therapy. It provides a steady stream of hormones in your blood, which have a lot of benefits over being on that roller coaster. So a lot of the benefits we're going to talk about with hormones, with the pellets, things like decreased heart attack risk, stroke risk, Alzheimer's risk. You have to be in that steady state. Going on the roller coaster, you don't have those same benefits. It's implanted under the skin, and you're sore for a couple days, but after that, you don't even know it's there. So one thing I get in my office a lot is the question is when did these things come out? You know, how new are they? And the answer is a long time ago. So pellets have been around since 1939. They came out, they were developed for women who had radical hysterectomies. And you could see the first study on it was in 1939, and they've been studying it ever since then. There's over 80 years of use and studies in the US and other countries around the world with pellets. So been around for a really long time. We know it's really safe, and it's very well studied. So this chart just shows with estrogens how the implants give you a much more steady state of the hormone. So on oral, you're really roller coastering up and down, and even on the patch, you know, you get a couple days worth, but then you're dipping and you have to take more to bring that back up. Where with the implant, with the pellet, you're just steady state, and it keeps you feeling good for a long time. So what is the BioT method? So basically, we're going to help the body return to normal hormonal balance and physiological state, optimized, and it's going to be based on the right kind of hormone, which is bioidentical, the right amounts, which is really important, this individualized dosing, because what you'll see is with a lot of the other methods, things like the creams and the injectables, they're very standard doses, and pretty much everybody's getting the same amount. And the right delivery system, which we think is the pellets. It's safe and evidence-based. There have been hundreds of studies on pellets with 75 years of experience used on 5 continents. It's clinically effective. There's even levels. Again, there's none of that roller coaster effect that we talked about. There's convenience with compliance. It's implanted only a couple times a year, so you don't have to take it every day, or you don't have to inject yourself every week. There's a very, very low side effect profile. It's the best method to increase bone density, and we'll go into that a little bit later with osteoporosis. And there is absolutely no evidence of increased breast cancer risk. It does not stimulate the breast tissue. There is also no increase in blood clot, heart attack, or stroke risk like you will see with things like the injectables. Studies show that hormone optimization may be protective to the breast, bone, brain, heart, and again, relationships. So let's talk about breast health. So there are hundreds of studies based on hormone therapy and breast health. And the take home is this: testosterone delivered by pellet implants does not increase the risk of breast cancer, unlike oral synthetic methyl testosterone. These implants also show less stimulation of the breast tissue. Treatment with testosterone and estradiol does not increase the risk of breast cancer, even in breast cancer survivors. In fact, there are some breast surgeons that are injecting testosterone pellets into breast tumors and showing that it's shrinking. And estrogen alone also does not increase the risk of breast cancer. And we'll talk, if there is a history of breast cancer, we typically do not give the estrogen just as a safety precaution, but there is really no evidence that it increases the risk. So this is a great slide. Breast cancer studies, what have they shown? So with hormone replacement after a diagnosis of breast cancer in relation to recurrence and mortality. So this study, there was 2,755 women between the ages of 35 and 74. Breast cancer recurrence was 17 per 1,000 in women who had hormone replacement therapy, and was almost double that, 30 per 1,000 in non-users, so people that had never had hormone replacement therapy. Mortality with breast cancer was 5 per 1,000 with people on hormone replacement therapy, and was 3 times that, 15 per 1,000 person years in non-users. Even total mortality, so just death across the board, was 16 per 1,000 person years in hormone replacement therapy users, and almost double that, 30 per 1,000 in non-users. So as you can see, not only is there no increased risk, it seems to be protective. So now let's talk about bone health. Osteoporosis, so something that a lot of people deal with in this country, especially as our population ages, and people live longer and longer past menopause and menopause. So testosterone is actually a bone builder. So it's not only going to maintain your bone, but it's going to build bones. So in people that use pellets, there is a 4-fold increase in bone density over people that are taking even oral, that should say testosterone, and a 2.5 times greater increase in bone density than people that are on testosterone patches. So what we're seeing is 8.3% per year of increased bone mass on pellet therapy, and you'll actually get that 8.3% every year for 3 years and then maintain that. Where the patches, it was only 3.5%, and the oral, it was only 1 to 2%. Arthritis. So this is something that I deal with a lot in my office. You know, I'm a sports medicine, and I deal with a lot of joint pains and joint injuries. So even before we were doing hormones, we were doing a lot of arthritis. So 10% of men and 18% of women over the age of 60 have osteoarthritis. We are in 2020, and it is the 4th leading cause of disability in this country. Both estrogen and testosterone have been shown to stimulate pre-cartilage cells, possibly reversing development of arthritic tissue. And also, really important, the reason why arthritis hurts is inflammation. And there's a lot of evidence that both testosterone and estrogen are anti-inflammatory. So that will also help with joint pains. And also, like we'll talk about, the testosterone helps you build lean muscle. So you're building muscle around your joints. Those muscles are stronger and your joints have less pressure on them. So that will also give you less pain. So there's a lot of reasons that the hormones really help with arthritis. Brain health. So Alzheimer's disease. Women get Alzheimer's disease 8 times more frequently than men. However, women on estrogen are 50% less likely to develop Alzheimer's disease, and men with low testosterone are 3 times more likely to develop Alzheimer's disease. And like we said, you really have to get that testosterone optimized in men above 900 to get that protective effect of Alzheimer's. Heart health. So women, hormones in the heart. So estrogen replacement with pellets has positive effects on body fat in postmenopausal women, as well as improved lipid parameters. So it's going to decrease your total cholesterol and your LDL, which again is your bad cholesterol. It's going to bring that good cholesterol up, and it's going to bring those triglycerides down. The addition of testosterone in women does not negate the favorable effects of the estrogen on the LDL. And also with the testosterone, you see a marked reduction in fat mass, with the estrogen plus testosterone. And then many studies show beneficial effects of natural testosterone on the heart as well. So for men, the testosterone pellets, again, they do the very same thing with your cholesterol. They're going to bring down your total cholesterol and your LDL. I had a patient, he's a young guy, with only the first round of pellets, we brought his total cholesterol down 30 points and his LDL down 30 points as well. And that's only going to get better as he goes on. And then some metabolic fats, you're going to see marked reduction in fat and improvement in lean body mass. So you're going to build that muscle. Also, building that muscle as we age is going to help prevent falls and lots of other things. And many studies show the beneficial effects of natural testosterone on the heart again. So some key facts. Hormone imbalance can occur in men and women at any age. So even if you're in your 30s, you can have low testosterone or you can have the early signs of menopause. So, you know, don't think that just because you're young that you can't have any of these things. Not all therapies are equal. So like we went over, you know, the absorption, the problems that you can have with things like the injections as opposed to the pellets. Hormone balance is not a one-size-fits-all approach, and that's what's really great about the BioT method is we get your labs based on those labs, your age, your weight, and many other factors. We calculate the right amount of hormone for you. So there's no standard dose. It's really based on the individual. I am a certified BioT provider, so you found one right here. And again, like we talked about, these low normal labs doesn't mean optimal. So what lab ranges are is they are averages. They are what most people fall into. But that doesn't mean that that's what your body needs. So like we talked about, you know, testosterone of 300 might be in the normal range, but you're still at increased risk for all of these problems if we don't get it up to that optimal range, which is 9 to 1100. Even things like vitamin D, you know, normal vitamin D in a lab says 30 to 100. But, you know, they actually just did a big study that came out a week ago that showed that if your vitamin D is below 60, you're at increased risk for heart attack, for several kinds of cancers, for all-cause deaths. So, yeah, you're 30 and you're normal, but guess what? You're not protecting yourself. You still want to be optimal. Same thing with thyroid and B12 and lots of other things. So, yeah, we want to get you tested. If you come to our office, if you came to this webinar, we are offering a free consult. We'll draw your labs, we'll send them off, we'll meet back in a week, we'll see what your levels are, and we'll see if the hormones are something for you. And I'll be taking any questions.
All right. Thank you, everybody. Dr. Savarino, for such a great presentation. And I think we'll keep this pretty informal. So if anyone, if you want to unmute yourself and perhaps ask a question, that would be great. So we'll take questions at this time. Okay, Dr. Savarino, there doesn't appear to be any questions.
All right.
So for everybody out there, just, you know, we did record this and we will send it out to you as well so you can review. And, you know, any questions, you know, feel free to reach out to Mary, Liza, or Jessica. They're very well versed in this BioT method as well to optimize your hormones. And once again, I just want to thank everyone for taking time out of your busy schedule this evening to join us and learn a little bit more about hormone optimization. And again, any questions, please reach out to Dr. Savarino. Dr. Savarino, thank you so much.
Great. Thank you guys for coming out. And yeah, again, if you have any questions, reach out to the office. Again, you're welcome to come into that free consult. We will take our time and we'll spend lots of time going over whatever problems that you have, and we'll get you feeling good.
Sounds good. Thank you, everybody. Have a good night. Take care.